Humans have a natural hatred for several things: snakes, spiders, skullduggery, needles, and salad. And only one of those hatreds is justified. I'm talking about salad, of course. Even the 2-year-olds know that salad is disgusting and a crime against humanity. But needles are at a close second place, and rightfully so. You should despise needles. It's actually good for you. And you should especially despise them when they're stabbing you in your back, supposedly providing back pain relief. My name is Mate from Real Deal Heal. I'm not your doctor, I'm not a doctor. This is not medical advice, but in 2025 and beyond, that may actually be a good thing. I struggled with really nasty back pain for more than 10 years actually. All the doctors told me there's not a lot I can do, things are only gonna get worse, and somehow miraculously I healed and I got better to the point where today I barely have any back pain at all. I share my experiences here, what worked, what didn't work, what I think can be valuable for you. Since when it comes to back pain in modern humans, I think a lot of doctors don't actually know how to deal with it properly. At least that's what happened in my case. Now, when it comes to injections, unlike most of the things I talk about on this channel, I actually don't have first-hand real-world experience with them. They were suggested to me, but even back then, during my worst back pain episodes, when I was honestly in the pits of despair, I didn't even seriously entertain the thought. The main reason for that is because even back then, I knew that injections are not a permanent solution. They're almost always used for just temporary relief, and that's something that can often lead to behaviors that kind of resemble addiction actually. People who take one back pain shot are likely to take another one. It's essentially the same issue I have with painkillers and drugs, except that you also get a needle in your back as a bonus. There's also the potential problem of injections not even working, of course, or maybe even having adverse effects. Things like infections and nerve damage are a real thing. But hey, it's Western medicine, baby. It's all about managing side effects, right? To be fair though, it seems like injections are not that commonly recommended by doctors anymore. There's somewhat more of an old school approach that's kind of losing ground in popularity, and rightfully so. I guess there's still maybe a few good use cases for injections. They may be like a semi-decent way to diagnose and pinpoint an issue, although if you're dealing with chronic back pain, it's very possible to discover a diagnosis that sounds correct and may even be true, but it doesn't actually pinpoint the pain source. It doesn't address the root cause of the problem. A herniated disc is a great example of this. Everybody knows and accepts that herniated discs cause back pain problems, even though there's a lot of people who have herniated discs and no back pain. So it can get a little tricky. What's probably a better use case of injections is as a temporary relief mechanism before physical therapy, in cases where the pain is so severe that the patient can barely move. But, one more time, another problem here is that physical therapy may not even be the correct solution. That's actually kind of what happened to me. I was recommended physical therapy, I went through with it, and nothing happened. It didn't really help at all. I'm personally not against physical therapy. I think it may be useful for some people, even though it was useless for me. But I think for a lot of people, it's still not gonna be the right answer, just as in my case. Okay, so if physical therapy is not the answer and injections are not the answer, then what's the correct answer? Well, that's best explained in a completely other new video. It should appear somewhere around here. The link to it will also be in the pinned comment or description. It comes down to the root cause of things. I don't want to say it's never a mechanical issue, but a lot of the times chronic back pain is complex. It means it has a strong emotional and psychological component, and you should be addressing issues of that nature. Luckily, the solutions for those types of issues are much less invasive and much more effective than injections. Less invasive and more effective than injections? Sounds pretty good, right? Well, not so fast. These solutions often involve something that we all struggle greatly with, which is lifestyle modifications and adjustments. But that's what this entire channel and everything, all my content is all about. it's probably a good idea for you to like and subscribe if you have some problems with your back or any related chronic issue for that matter. I know what it's like because I went through the same thing. I know how it feels. I know how tough and isolating and depressing it can be. I know it sucks, so you should get all the support you need. Also, if you know someone else struggling with back pain, share these videos with them and ask any questions in the comment. I'll try to get to all of them. Oh, and by the way, did I mention I have a completely free book written for you? It's 150 pages based on my very own experience. What works, what didn't work, all of the things I tried for 12 years, how to make a perfect strategy for you, how to find things that work in a way that's almost bulletproof, I want to say. So definitely check it out. It's completely free. And if for whatever reason you want to keep binging on these videos, the next video that's going to appear somewhere around here should be a great choice. I'll see you there, and until next time, be brave.